Hi, everyone. My name is Brianna Corlett. For those of you that don't know me, I primarily am a content creator on TikTok, but I had an opportunity to interview Dr. Sears. If you are a 90s baby or a 2000s baby, your parents probably know who he is. My parents raised me on his teachings. He was my fiance's pediatrician. And so this interview has a lot of meaning to me. I wanted to interview him in general, just to ask him a ton of questions. I'm not a mom yet, but I'm going to be at some point. And he is a world-renowned pediatrician with so much life experience, not only as a pediatrician, but a father of 8 children. Him and his late wife, Martha, were married for over 50 years. And he just has so much knowledge to share with the world. So I figure why not just film my interview with him and share it with you guys. Dr. Sears has written over 40 books. He's been interviewed by Oprah. He's been on 2020, Dateline, The Morning Show, the list goes on. So the fact that he sat down with me is such an honor. Him and his wife met while he was in medical school and she was a nurse. And with Martha's medical background and real life experience as a mother, they were able to share so much information on the world. They have shaped generations of parenting and their outlook on attachment parenting and just the way we look at motherhood. I think in a world of AI, it's really hard to differentiate what's true and what's not. Even with like TikTok, there's so much information out there, and I just find that sometimes finding information and knowledge from people who have real life experience is the best way to get information these days. Not only is Dr. Sears a world-renowned pediatrician, like I said, a husband, a father, he also survived stage 3 colon cancer and just has so much experience in health in general and longevity. He actually just released a book on aging healthy. I'm gonna link all of his books for you guys in the caption. So if you are interested in buying a book, I highly, highly recommend it. Especially his baby books are like a Bible. I have a cousin who's a pediatrician and she literally goes to his website to look up questions that her patients come in with because he is so knowledgeable. So we just scratched the surface in this interview. Again, if you want more information, I will link his website, I will link his books, so you guys have access to all of that because he really is a goldmine of information, especially for new moms. I'm gonna shut up now and get into it, but bear with me, it's my first interview. Hopefully you guys enjoy. I feel like there's so much information. There's AI, there's social media. Everyone has an opinion, you know?
Yeah.
And sometimes there's not really much experience behind it. And I feel like that's why I wanted to talk to you because you have so much life experience as a father, a husband, a doctor, all these different things. So I just have all these questions I want to ask you. You've cared for generations and generations of families, and you have so much experience. But if there's one of the biggest parenting advice you could give, what would it be?
For mothers, listen to your mommy brain. Do what your mother's intuition tells you. And I remember one time our 8th child, she was about 5 or 6 years of age, in the kitchen, and she was throwing a temper tantrum. We called it a hissy fit.
Yes, of course.
And I'm ready to just pick her up right away and take her to the room, and that's my daddy brain.
Yes, yeah.
Martha, within 3 or 4 seconds, calmed her down. She got down on her knees at her eye level and spoke kindly to her. Lauren picked up all the mess she made in the two. And later I said, Martha, how did you know what to do?
Right.
How did you know how to respond? And she said, I took a deep breath, relaxed, and I thought, if I were Lauren, how would I want my mother to respond?
Right.
And I did that.
Yeah.
She got behind the eyes of the child. If I were my child, how would I want my mother to respond?
Wow, I never even thought about that.
Yeah.
Yeah, it's true because like you just think the quickest thing is to discipline, right? Yeah. But sometimes you just need to like think what the child is, what the child needs. But I think, there is probably a difference between mommy and daddy brain.
Oh, there is.
Yeah.
And for a good reason.
Right.
Yeah, there is a, see, mommy brain, mommies don't realize during pregnancy, they grow an area in their brain.
Wow.
It's kind of like an internal GPS.
Yes, yeah.
My baby needs this, I do this. My baby's crying, this is why she's crying.
Right.
My baby is fussy, do I just relax a bit or do I pick her up? You know, the mommy brain.
Right.
So by the time baby comes, that mommy brain is there. And then it grows. We call it growing together during those early months. Baby does this, I do this.
So
and
it
no
grows
book.
when the baby's in the womb.
Yeah, and it starts the baby's in the womb. And I tell moms, no book or no expert, no one should ever tell you how long to let a baby cry. That's a mommy brain.
Right.
There are times that you don't have to rush and pick her up.
Right.
And the baby will settle themselves.
Right.
There are times when she needs me. In the old days, it was, oh, you're making your baby too dependent on you.
Yeah.
And it was let them cry, put them to sleep and let them cry to sleep.
Right.
Get them on a schedule. I called it kind of like training a pet.
Yes, it feels like that. I mean, nowadays there's all this stuff about the cry it out method and sleep schedules and feeding schedules.
And see, that's designed to sell books.
Right, right.
You have to come up with something new.
Yes, yeah.
But there isn't much new. This has been going on for centuries.
Right, yeah.
The mommy brain.
They know, yeah.
I remember when we developed the baby sling, the baby carrier.
Right.
1985 it was when Martha designed it, developed it.
Yeah.
Boy, oh, you're making your baby too dependent on you. And I'm thinking, mothers around the world wear their baby for centuries.
That's so true. Yeah.
You know? They know what works.
Right.
You know?
They know. Yeah.
And then I started thinking, I started watching Martha. So I thought, wow, do you wheel them or wear them? There's a baby in a wheeler. The baby's looking straight ahead and mommy's behind the wheeler.
Oh, yeah. They're not even looking at the mom.
But the baby here, the baby is intimately tuned in to the body and mind of the mother. When mother speaks, baby hears. You know?
Yeah.
And even like cheek to breast, just a deep breath. And so what mommy sees, baby sees.
Right.
So that's why we developed the concept of baby wearing and attachment parenting.
Right.
Back when it was spoiling babies.
Right.
Now it's standard.
Now it's standard.
Now it's standard.
But it is, like, even just for me on TikTok, on social media, I see all this stuff now about attachment parenting and how now it's the cry it out method and the sleep schedule. And all these young moms are trying to figure it out.
And when you see anything that says cry it out, don't do it.
Yeah.
No.
Okay.
Because think about it for a minute. How does anyone else know doesn't have a mommy brain for your baby?
Right. Right.
You know?
For your baby.
Don't listen to them. So if you see the word schedule or cry it out,
just yeah.
And I remember Martha one time said to me, don't listen to anything that's written by anyone who hasn't had at least 4 or 5 babies.
Yes, so true. My mom had 4 babies.
Oh, good.
And she said the same thing. Like, she would never do the cry it out. It was like she just knew what her baby needed. And all 4 of us were different.
Exactly.
Which I'm sure all 8 of your kids were completely different.
Our first 3 were rather easy.
Right.
And we thought, what's all this stuff about? You put them to sleep, they stay to sleep.
Yeah.
Then number 4 and 5.
Right. Threw you for a loop.
We're different.
Right.
You know?
Another thing too, obviously, is vaccines. And I know it's depends on who. But I remember one of the things my mom learned from me was scheduling them out. Do you still have the same thoughts on that, or how do you feel?
See, what we're learning now, and I'm very pro-vaccine.
Yes, yeah.
All of our children are vaccinated.
Right.
But what we're knowing now is to personalize it. That's why the vaccine schedule is being changed.
Yes,
by people in Washington.
Right.
See, mothers determine the future of baby care. Listen to mothers. For example, let's take the hepatitis B vaccine, which in many hospitals are given the first day of birth. The smart mom says, as the doctor comes in with the needle, says, well, doctor, please, I trust your opinion. I just have a question. I'm hepatitis B negative. My 1-day-old baby is unlikely to be sexually active.
Yeah. Right.
So why does my precious little newborn need a shot that has a high chance of causing fever and she remaining in the hospital?
Right.
And the doctor will, smart mom. The doctor backs off. See, so we're seeing a whole change, but it's run by mothers.
Right. Yeah.
Another example is birthing. With our first 2, dads were in the waiting room and moms were in a room that looked like an operating room,
Yeah.
just a sterile operating room, and lying there in an uncomfortable position because it was easy for the baby catcher.
Yeah.
The mother started thinking, wait a minute, my body, my baby, my birth. So they go into a hospital and says, hospitals, when you design a birthing suite for my body, my baby, my birth, I'll come to your hospital.
Right.
And those who don't aren't going to stay in the baby business. Now, any hospital who stays in the baby business, it's like checking into a 5-star hotel.
I know. I was just looking at the Hogue in Irvine, the new one. It's so nice.
It's beautiful. You have a hot tub that you can labor in. If your labor gets intense, you can go in there for a few minutes. And mothers had to do that.
They determine. Yeah, of course. Right. Because I remember at dinner the other night, you said something about how for a long time men were telling women how to parent, and it wasn't working, obviously.
It wasn't working.
Yeah.
It wasn't working.
And how could it? It's like men don't give birth.
No, that's right. They used to have childbirth classes for the dads to be.
Yes.
Here's what you do. And the men forget everything.
Yeah, of course.
And so I said, listen, you love your wife.
Yeah.
You hire a labor coach or a doula, they call them.
Yeah.
A woman who's had babies, or a midwife. The woman helps a woman. You love your wife.
Yeah, you're just there.
You're there to love your wife. Say the doctor comes in and wants to do something well, doctor, just wait a minute, could we discuss this?
Right.
So you're there to help her have the atmosphere of birth.
Right.
Or Aaron, or at number 5, we have so many, we just number them.
Got to number them.
When she became a mom, and Martha and I went up, and we were going to be there in the birthing room. I'm going to be grandpa.
Yes.
I'm not going to be a doctor. I'm not going to say a word. Things were not progressing well. They had her confined to bed. Wow. So fortunately, she had a very understanding obstetrician. I said, could we let her follow her body for a little bit and get up and sit on a ball and buff once while squat if she wants around, play music, and see what happens, because they had her scheduled for a surgical birth in 2 hours. Fortunately, the OB was nice. She says, okay, we'll give her an hour and see.
Yeah, right.
So within an hour,
baby came?
Baby came.
No way.
Because mother could follow.
Intuition.
She knew when to sit down. She knew when to open up. She knew when to get on all fours. She knew when to yell at her husband.
Yes, scream. Exactly.
She was following her mommy brain, and her mommy brain told her what to do.
And she's communicating at that point with her baby, too.
With her baby, exactly.
Yeah, it's so true. I even hear it like about natural births and stuff. It's like women have been giving birth for centuries. It's like we know what to do.
We know what to do.
And now with modern medicine, obviously, there's all these things to help you.
To help you,
but
exactly.
In terms of like...
The term obstetrician comes from the Latin obstare, meaning on standby.
Oh, okay.
See, so the modern birth, for many women, they have a midwife and an obstetrician. And the midwife, a mom herself and all, the midwife helps her get ready, but maybe 10% of the time, 12% of the time, the birth plan isn't working.
Right.
So the obstetrician is on standby.
Right.
And because the ultimate goal is a healthy mommy and a healthy baby.
In terms of like a natural birth versus an epidural or something, do you have any opinions on that?
Well, I think it depends on the mother. Nowadays, there are so many ways of pain relief.
Right.
Like Martha and I used to call it expansion instead of contractions.
Oh, right.
Yeah, it's a positive term.
Yeah, right.
Contraction sounds painful.
Yes. Yeah, it does. It sounds terrible. I can't imagine.
Right.
Yeah. Expansion.
It's the whole atmosphere of birthing now.
Yeah.
Because think about it. It's the biggest memory a mother will probably ever have.
Right. Yeah.
Maybe second to her walking down the aisle or a wedding or so.
Right.
But you want to create an atmosphere of, wow.
Beautiful
atmosphere that helps her,
and be positive. And it's a beautiful thing.
Yeah.
It's not this terrible thing.
And I remember with one of our kids' births, there was a grandpa. The nurse was coming in and looking at the wires and all these things, and she was negative. Oh, this is concerning.
Oh my God.
You don't say that in front of them. You can think that, you talk to the doctor about it, but you want the mother to believe in her body.
Yes, of course.
Believe
Yeah.
your body is made to birth your
Right.
baby safely.
Yes, and it is.
It is.
Right? I mean,
Yeah.
99% of the time.
And,
it's like,
about, I'd say 10 to 12% of the time, you need a surgical birth. And
Yeah.
today's surgical births are very, very, very safe.
right. Yeah. And I feel like that's something, like, as someone who hasn't had a child, it's sometimes on social media, it makes it seem so scary and like this terrible thing. But my mom had 4 natural births, and she has such positive
Sure.
experiences.
Exactly.
Obviously, it's not, there's pain, but
Social media, you have to be careful.
yeah,
Because controversy sells.
that's so true.
Surround yourself with other women.
Yeah.
Talk to, like your mother had 4.
Yeah.
If you're having your first, just talk to people who've had 4. Tell me.
Right.
Give me some tips.
Yes. Yeah.
There's some
Talk to
tips.
other women. Back in the day, it was like formula was bad, and now formula has gotten so advanced, and there's good formula. And like, what's your opinion on nursing? And like, as long as you can, how often do you do it? Is there a schedule, feeding schedule?
My dear wife, Martha, nursed for 19 years.
Wow.
Our 8 babies,
Yeah.
All
That's
right.
a long time.
including a child with Down syndrome, was very hard to nurse, and an adopted child. I've been around nursing
Yes.
for a long time. My wife nursed was what's called a lactation consultant. So I'd come home from the office, and our living room here was full of mothers and babies at the breast.
Right.
And she'd teach them. God's greatest design is a human body. The female body, beautiful because she can birth another body.
Mm-hmm.
The baby, to me, is the greatest creation, our national treasure.
Mm-hmm.
So you figure you're the creator designing the baby. Baby's born into a germy world, and baby has an immature immune system. So that's high risk. You have a baby with an immature immune system coming out of mom into a germy world. Therefore, wouldn't you design a system that quickly gave baby a good immune system?
Right.
And that's what breast milk is. It used to be called white blood
Yeah.
because it's so full of all the
Life.
immune boosters.
Right.
Like right now, we call it cheek to breast. In the old days, the babies was born, they'd go over to the nurse, and the nurse would wipe the baby off and everything, and 5 minutes later give the baby to the mother. Now it's baby comes out, soon as baby's pink, cheek to breast.
Right. Skin to skin, right?
Skin to skin,
Yeah.
cheek to breast. So baby gets used to the mommy bugs, not Nurse Nancy's in
Right.
the hospitals.
Right. Right.
So immediately that first milk is building the immune system.
Right. Yeah.
The whole birthing process as baby comes through the birth canal, baby has certain bacteria from the mother that primes the immune system.
Right.
And then you add breast milk to that, and then you start nursing more and more, and each day. As Martha used to say, oh, Bill's an expert in sick babies. I trained at all these big hospitals. This works, this doesn't. And I'd watch Martha nurse.
Yeah.
I would see this big smile, this radiant, mommy gets a surge of happy hormones.
From nursing.
From the baby is nursing,
Yeah.
and the baby feels good, all of mama's good milk, and then the mother gets a great feeling from the hormonal surge of the happy hormone.
Wow.
See, so it's a beautiful system.
Yes.
It's a beautiful system designed for the health of the baby and the happiness of the mother.
Of the mother. Wow. Yeah. That's so interesting. I didn't ever think about the happiness of the
Happiness
mother.
of the mother. We have what we call the 7 baby B's of attachment. Some moms can do all 7, some can do 5. And I
What are the
first of all,
7?
birth bonding,
Okay.
number 1.
Okay.
Breastfeeding,
Okay.
2. Baby wearing, a baby carrier. Bedding close to baby. You say, well, where should baby sleep? Answer, where mommy
is.
and baby sleep the best.
Okay. Yeah.
And that may change.
Right. Right.
Next is belief in the signal value of a baby's cry.
Yes.
Baby's cry is a baby language.
Right.
Next, beware of baby trainers.
Right.
Like you said, to let them cry out and all. Beware of baby trainers.
Right.
But then there's the 7th called balance. What baby needs is a happy, rested mother.
Right.
And I remember one time, Martha, one day saying to me, oh, I don't have time to take a shower. My baby needs me so much. Red flag.
Right.
mommy burnout. So I lovingly said to her, and I put a big sign on the bathroom mirror, what our baby needs most is a happy, rested mommy.
Yes. Yeah.
Our baby needs most is a happy, rested mommy.
Yeah.
You go take a shower, go take a walk, do something for yourself,
For yourself.
and I'll nurse the baby.
Right. Yeah.
And she says, yeah, see, nursing means comforting.
Right.
Only mommy can breastfeed. Daddy can nurse. Nurse means comforting. So Martha goes and takes a nap and a shower, and I take fussy baby. I open my mouth, now I got to deliver. I don't have the two great pacifiers Martha does, but I have a deep voice. And a lot of babies are calmed more
by a deep voice.
By the deep, monotonous, monotone voice of a dad. Babies hear with the vibration of their skull bone. So I would put Matthew like this and drape my chin over his head, and I would sing, go to sleep, go to sleep, go to sleep, my little baby. Oh.
And he'd go out, wow.
And
there's your daddy brain.
Yeah, daddy brain. Daddy nursing. You know, daddies need to deliver. A dad actually, Brianna, has a double job. The mom takes care of the baby. Daddy helps take care of the mommy and the baby.
Yes, yeah.
So dad creates an environment that is even better for the mother. I would help Martha, we called her nursing nest, like a rocking chair, and I'd make her a smoothie by the window, put her music on.
Right.
So my job was to create an environment that helped her breastfeed more carefully and enjoy mothering and all that.
The dads feel so helpless when the baby comes because the mommy is nursing and has that connection with the baby. And sometimes the dads, they're like, what do I do? I'm just here. And it's not as natural.
It's amazing. Mom should just give the baby to dad.
Yeah.
Don't hover around.
Yeah.
Ready to rescue fussy baby from fumbling daddy.
Yeah.
Just give them time. A dad will get it together.
So these are all Dr. Sears' books. Anything we talk about baby stuff, there's like 20 times more information in these books.
In the baby book.
How many books have you written? 40?
40, we're in 48 now.
Wow. Healthy pregnancy.
Now, the healthy pregnancy book I want to mention. That's where the biggest mistakes are.
Yes.
That's the most important thing for a woman. Who do you want making decisions for you? You want an obstetrician. So we have 4 authors here. We have a university professor, mother obstetrician, number 1. You want a midwife. We had one of the PhD midwives in the country. You want a mother of 8, Martha.
Right.
And you want a pediatrician who's been in 1,000 births.
Right.
So our baby book has those 4 credentials. Look for the credentials of the author.
Writing it.
Because I find so many, as you say, moms are on overload right now.
Yes. There's too much information. But I think the biggest takeaway I've taken from you is just to listen to your mommy brain, follow your intuition.
Yeah, right.
And remember that women have been doing this for thousands and thousands of years. So there has to be something that we can trust in ourselves and trust that God made us in a way that we can protect and nourish our baby, right?
Yeah.
So this one is called Primetime Health in the Healthy Brain Book. You obviously have survived cancer. And I think through that time, you kind of learned more about adult nutrition, right?
Yes, I did.
I think diet is obviously a big thing. It's like some people say do keto, some people say vegetarian, no red meat. Like, do you have any advice on the best diet to eat?
The term diet just means a way of eating.
Yeah.
So we're all on a diet.
Right.
To sell books, you have to keep coming out with these books.
Right.
And one size doesn't fit all. I made my change in 1997, but like many men, it took cancer to cause me to care and to change.
Right.
Because I had a lot to live for.
Right.
A wonderful wife and 8 children.
And now grandchildren, 15 grandchildren.
I decided 30 years ago, my mantra was make health my hobby.
Yes,
so
I love
tell that to moms and dads. Make health your hobby. What you owe your children is a healthy mom and dad. So I started studying the health effects of many things. So the first thing I found, I call it my 5 S's. Move smart. the 5 SMART, because we are made to move. So many people suffer from what I call the sitting disease.
Yes.
You know,
Yes.
that's a new word in the doctor's dictionary. So I started studying the whole effects of movement.
Right.
Movement. Wow. And again, I thought, wow, people don't realize the human body, God's greatest creation. God knew we were going to mess it up by how we eat, think, and live.
Of course.
So God puts within our body our own personal pharmacy. So you have pharmacies in your body that make up for your mess ups.
Right.
And they've identified 25 different medicines that we make. You know, medicines that lower the highs, high blood pressure, high blood cholesterol, high blood sugar.
Right.
Medicines that raise the low, antidepressants.
Yeah.
Medicines that mellow your moods, anti-anxiety.
Right.
Anti-inflammatories, all those things. So we have a pharmacy inside. What's the best way to open that pharmacy? Movement. See?
Yeah.
And I spent 2 days with the Nobel Prize winner who discovered that movement, any type of movement, opens trillions of medicine bottles on the lining of your blood vessels. So you want to have some fun, you're out walking with a group of friends, you say, feels so good, I'm making my own medicine. I'm opening my pharmacy just by movement. See, move smart. Eat smart, healthy foods. Smoothies, I have a smoothie in the morning. They call it smoothies. It smooths digestion. It smooths blood sugar. Blood sugar spikes are an epidemic now.
Yes.
In younger ages, type 2 diabetes. Smooths blood sugar spikes, smooths digestion. It smooths elimination. So I have a smoothie in the morning, and I have salmon in the evening 3 days a week.
Okay. Salmon, I know my fiance, you were his pediatrician and his brother, and they always have told me salmon, Dr. Sears says salmon, Dr. Sears. So why is salmon so important?
I'll show you a picture. If I can find it here. There we go. Suppose this was a picture of the human brain.
Okay.
And inside the brain, you list the 10 top nutrients that are in the brain needs. Same with the salmon.
Wow.
There is no food on the planet, no food on the whole planet that even comes close to that you can get 10 nutrients that the brain needs in a measly 250 calories.
Wow.
See? So that's the top food. That's the top food for mommy brain and daddy brain and children's brain. In the old days, they used to start solid foods with rice cereal. There's no fat.
Right.
You're growing an old fat head. That's how I tell them. You're growing a fat.
Yeah.
Fat.
Right.
So your first food is avocados at 6 months. Salmon at 7 months.
Okay.
That's our motto. Salmon at 7 months. Little by little, shaping young tastes.
Yes.
And children will grow up to crave salmon.
Right. Yeah. And should the mommy eat salmon while they're pregnant too?
They can. Good salmon.
Right. What's a good salmon?
Good
Wild
salmon,
caught?
Wild caught. This is from a fisherman in Alaska. Alaskan has very clean salmon. It's clean, all that. Lumi Island Wild. It's very clean and safe, so mothers can, eat a little bit. So yes.
Okay.
So I'll tell you a little bit of another pregnancy story. I wondered why the omega-3 fats in salmon, called DHA and EPA, why are they the top food for a newborn baby and a baby in the womb? On a tour, one of the top neuroscientists, Dr. Michael Crawford, from England, he came over here and he asked me to tour with him because he's a very famous neurosurgeon. I'm just a simple doc, so I would come on after him and make his talk simple.
Right, right. And you have a way of doing that in your books too. Yeah.
I'm just simple.
Right.
So he told me a story which riveted me on why mothers need to take more omega-3s.
Right.
DHA, especially during pregnancy.
Yes.
That they did this with animals, obviously. They studied the blood vessels from the mother into the placenta, and they found that the level of the DHA omega-3s, when it goes through the placenta does what's called biomagnifies the DHA. So when it comes out on the baby side, it's 4 times higher than the mother side. So my conclusion, wow, if mother's designed to do that, the baby needs it.
They need,
So let's get that baby into eating salmon quickly.
Salmon. Yeah.
Yeah.
That's so interesting.
Yeah.
Okay, so salmon 3 times a week.
Three
I need
times.
and you get it from that place in Alaska?
Yeah.
Okay. I need to tell that to Devin because he's very picky about his salmon.
Oh, yeah.
Because of you, because he said wild caught has to be clean.
And another little clue, the redder the better.
Yes, right.
A real wild-caught Alaskan salmon is red.
Red. And you eat sockeye?
Sockeye or king,
Okay,
either one.
right.
And that redness comes from a nutrient called astaxanthin that protects their muscles as they swim upstream for 4 miles.
Wow.
See, so the redder the better.
So we have move smart, eat smart,
Then sleep smart.
sleep smart, of
Okay.
course.
Now, mommies need sleep. I remember times I had to get up. What we would do is on weekends when I was home, baby'd wake up in the morning. Martha would nurse the baby. I would take baby out for a walk, not within hearing distance of mommy,
Right.
so that she could sleep in.
Right. Yeah.
Sleep in.
Yeah.
See, sleep is healing. So you do not want to be sleep deprived.
Right.
And what people don't realize during sleep is when a whole army comes into your brain
Right.
and does house cleaning.
Yeah.
And we call it brainwashing. It's like a big pharmacy. Like you have all these medicines that are being made during the night in your brain, but they clean house of all the stuff you don't want to remember.
Right.
Like sometimes you go to bed with a problem, you wake up with a solution.
Yes, so true.
You've been brainwashed.
Yes, yeah.
So we have a whole section on sleep smart.
And that's in here,
That's
right?
in here too.
This-
And then
okay.
the fourth is think smart. See, a child's brain grows the most in the first 5 years. 90% of the child's brain grows in the first 5 years.
Wow.
It doubles in size by 2, sometimes triples by 2 or 3. Nourish the child's brain at the very time of the life when it's growing the
It's
fastest.
forming. Yeah.
That's why we stress good nutrition, good exercise, and all during the time when the baby's brain is growing.
Right.
And
so ages 1 to 5.
Yeah, and I have a theory. I was always why are babies, these little toddlers, they're 1.5, I call them wiggly squiggly kids, they're moving all the time.
Yeah.
And I'm looking at it, but when I was studying the beauties of movement, when they move, the blood flows faster to the brain, and the brain is growing fast.
Right.
Then the brain uses 25% of all the blood the heart pumps. So better heart pumping, better blood flow. Next, as we talked about before, your big pharmacy that makes growth hormone
Yes.
is in the lining of your blood vessels too.
Right.
So when you move and all that, like a baby was saying, I'm making my growth hormone.
Right. How many years were you married?
Nearly 60 years.
6 years.
Yeah, 60.
And you had 8 children.
8 children.
15 grandchildren.
15 grandchildren. 15 and 1/4 now.
Wow. Oh, one's on the way.
Yeah, one's on the way.
Oh my goodness.
Lauren.
So amazing. I think there's so much to learn from you and Martha's marriage, and you had such a beautiful marriage. Obviously, ups and downs like everyone. It's not perfect. What would your biggest advice be for people that are getting married? Like
Sure.
Devin and I are about to get married. Like, do you have advice for us?
Yes, I do. My mother was a single mom, so I was the only child with a single mom. My dad took off when I was a month of age, didn't want kids. So I would have been called an underprivileged kid, lived in a spiritually rich but financially poor home. My heart goes out to single moms.
Yeah.
It's tough.
Yeah.
My smart mom surrounded me, Brianna, with quality male mentors. I had football coaches, baseball coaches, scoutmasters, priests, male mentors.
Right.
She made me go to a Christian Catholic school. When I was a teenager, I wanted to go to the fun school.
Yes, of course.
You know, no God, no rules. I want fun school.
Yes.
And my mother said, no, Billy, you will go to Marquette High and you will get a summer job to earn the tuition. Mom, thank you, Mom.
Yes.
Mom was right. So Martha and I get married, and because of what happened in my family, I programmed my mind that divorce was not an option.
Yeah.
We almost got divorced 5 years into our marriage. That's why I'm telling this story, because I learned. I came home one day from a hospital, training at the world's biggest hospital, and I was offered a job as chief there and all that.
Wow.
I come home to tell Martha that, and she looks at me and she says, Bill, you're married to medicine. Those 4 words changed my life.
Wow.
It was like a light bulb went on. She's right. I never knew that I was putting myself and my profession before her. So I looked at her and said, honey, I commit to you from this day on, for the rest of our hopefully long married life, you first, me second.
Wow.
Was my marriage commitment that saved our marriage.
Wow.
9 months later, kid number 3.
Yeah. Exactly.
Right? Babies kept coming.
Right.
But I didn't realize that Martha felt that way. I didn't realize that she didn't think that I was putting her first. So she had to tell me that.
Right.
So that saved our marriage. It's like a light bulb goes on.
Right.
Oh my goodness.
Right.
So when I said you first, me second, that was my commitment. I stuck to that.
Right, yes.
For 59 and a half
59
years.
more years. Wow. And so you didn't end up taking the job, right? And you ended up staying.
I turned the job down.
Right.
I went in the next day. Thank you for the honor, but I need to go home.
To your wife and.
I need to go home.
Yeah.
Because I don't belong in academic medicine.
No.
I'm going to be a small town doc.
Yeah.
And I just want to see children and moms and dads.
Right.
Not be in some hospital.
No.
I would teach at the hospital in the morning.
Oh.
And then have a practice in the afternoon. I did that most of my life.
But Martha, I think, probably knew too that you were more suited for.
She did. She knew that.
You know.
She knew that I just belonged as a simple pediatrician.
Yeah. Well. You ended up being more than just a simple pediatrician, but oh my gosh, that's amazing.
We were on TV with Joan London one time on Good Morning America, and she says, Martha, how did your marriage survive writing all these books together?
Yeah.
And Martha's favorite for her one-liners. And she said, Bill writes it, I fix it.
Exactly.
So
exactly. And that is marriage.
That was marriage.
That's marriage.
Yeah. Yeah.
That's a relationship.
But I do a lot of kind of marriage counseling to friends when it's very weak. I said, especially the men, I'll just ask them, have you committed to your wife? You first, me second? Have you told her that? That's
hard to do. But I mean, once the light bulb goes off, it makes sense. And that's marriage, I think, right? Is putting someone else before yourself.
Yeah, it does.
This is something like my parents are dealing with right now.
Yeah.
From being an adult-child relationship to now you're an adult to an adult child, right? And that transition of parenting and like how do you let go and let your kids go out into the world and not want to just do everything for them.
Right. I have a big card on my desk in there from my daughter. It says, a girl never outgrows her need for her dad.
Yeah.
See, your kids are always your kids.
Yes, of course. Of course.
And you're always going to be helping them adjust to the world.
Yeah.
But I think one thing the fathers can do, like when our daughters are going to get married.
Yes.
Husband to be, I just want to prepare you for my dad.
Oh.
He means well. He loves me, but he's going to grill you.
As you should. Yes.
I said that to all my 3 son-in-laws. Are you willing to put my beautiful daughter, your wife, say to her, honey, you first, me second. If you're willing to do that and live that, you have my permission to marry my daughter.
Don't do it. You're not going to give him the blessing.
That's right.
Yeah, and I think that's hard too because my dad has 3 daughters too. 3 girls and my brother's the youngest. But I think like that's so hard because you want to make sure that you're giving your daughter away to somebody who you trust.
Exactly.
But I think like that is like the biggest key of marriage. Like what I'm learning from you is like putting your husband or your wife before you.
Yeah.
And I think that's hard for men to do that sometimes.
It is hard, but you learn it works because if your wife feels that, then she is a better wife for you. And you're better off.
Yes.
See, so you're actually doing well for yourself too.
Right.
Yeah. And so Martha, she had a wonderful way of putting it. She gave me a little list one time of ways I'm thankful for my child, for my husband.
Oh,
she's a provider, protector.
Yes.
He really practices me first.
Yes.
Me
And every
second.
decision you make.
And then
right?
she said, and he can handle a little abuse.
Yeah. A little verbal abuse here and there.
I can handle a little abuse.
A little slap here and there. That's so funny. Oh my gosh. You guys had a beautiful marriage, beautiful
It was,
family.
yeah.
Yeah.
The day before she went to heaven,
Yes.
where you're sitting was where her bed was.
Oh.
I asked her, I said, when she was able to still able to talk a little bit,
Yes.
a little bit coherent, she had COVID. She
Yes.
had long haul
Long
COVID.
COVID.
I said, honey, how do you want me to carry on our legacy? And she looks at me, she said, keep healthy. I'm glad she said that first, because if you're not healthy, you can't do much.
You can't. Yeah.
Keep healthy, serve God, serve people. So she wanted me to continue like right now.
Right. We're helping spread your.
Somebody's going to be listening to you.
Yeah.
And maybe if what you said and what I said changes the way they parent for the better,
Right.
and how they feel about themselves,
Right.
then we have what I call the helper's high.
Yes.
You know, we'll go to bed at night with the helper's high.
Right.
And a half hour before she went to heaven, she's lying right there. She can't talk, and her eyes are closed.
Yeah.
She opens her eyes halfway and moves her lips, and she said, I love you,
Oh.
with her lips.
Yeah.
And then
she went to heaven.
that was it.
Wow.
So, and her family's around her.
Yes. She had a beautiful life.
It was a beautiful life because she wanted to leave me feeling well.
Yes.
She wanted to leave me feeling
Even
good.
in her last moments, she put you.
Right, she was putting me first.
Wow. Wow. That's amazing.
Yeah.
And I met her for just a brief moment that one time I was here, and she was so beautiful.
Yeah.
You guys had such a beautiful, even just looking at all your photos around the house, it's like such a beautiful life that you guys created, and it's so amazing. And I think it's such a testament to what you're saying. You guys put each other before yourselves, you know?
Yeah.
Supplements? Do you take any supplements?
There's a lot of supplement confusion.
Yes.
We have 25 pages in here on how to go select a supplement.
Okay.
Because you see these ads on TV.
Yes.
People are confused.
And they're not
Yeah.
cheap.
Number one, do you need it?
Yes.
8 servings of fruits and vegetables every day? No, I can't eat that much. Okay, then you need a fruit, berry, and veggie supplement.
Right.
Do you eat 3 fillets of fish every week?
Yeah.
Oh, I don't like fish, I'm a vegan. Therefore, you need to take an omega-3 supplement.
Right.
But the big thing, Brianna, show me the science.
Yes.
See?
Yes.
And that's like you're looking at an ad on TV, why you should take all this. And I'm waiting to hear the science supporting our supplement.
Right.
It ain't there.
Right.
Because they didn't do it. And if they did it, they'd be proud.
Right.
And what you want to look for is what's called a bioavailability study. And some supplement companies have it and some don't. But basically, they give the people the capsules of the supplement.
Right.
And they draw blood, and they find is what's in the capsule gets into the bloodstream.
Right.
If it doesn't,
then what's the point?
right,
It's just a waste of money.
See?
It's probably just sugar or something.
Yeah, so that's why I take what's called Juice Plus.
Yes, yes.
Because it has those, show me the science, and I need it. So basically, always look for that.
And do the research.
Show me the science. So you mentioned colic.
Colic, the doctor doesn't know.
Now, colic is a 5-letter word meaning the doctor doesn't know.
Right.
Okay. So we don't use that word anymore in pediatrics, because if a baby's crying and obviously uncomfortable, there's a reason for it. I started studying that, 25 years ago probably, that I thought my mindset was babies crying for a reason, I gotta find out why.
Right. And
one of the top reasons we found was what's called gastroesophageal reflux, or GERD.
Right.
You know, they were refluxing stomach acid up into their esophagus once, and they're tests for it now.
Yeah.
So we found that was the top cause of colic, and you can fix that easily by feeding them differently.
Right.
Secondly, food allergies is another one.
Okay.
And then sometimes it's something painful. I had one child, I was pressing on the abdomen, I feel this sort of a tennis ball type of thing.
Oh, no.
And it was a tumor.
They got it out.
Got it, and baby was fine. But you look for the
reason.
cause.
So there's always a reason,
There's always a reason.
Because it's not, that makes so much sense.
Yeah.
Because there has to be a reason the baby is.
Right. There's a
And I'm
reason
sure you
babies
have a
cry.
section about that in one
We
of your
do.
books.
We have a whole section on the colicky baby and
what
all
to
that.
do.
Yeah, what to do.
If you feel that your baby's sick, at what point do you go to the ER or the doctor?
When your mommy brain tells you.
So you just trust.
When your mommy brain tells you. I've had incredible experiences where, say after hours, a mother would call me and I could listen to her voice that she felt something was wrong.
Right.
And several times, okay, get in the car now, I'll meet you ER. And a lot of times there were a couple very serious things
Right.
that if I had dismissed them, baby would. So yeah, when your mommy brain says something's wrong,
right,
and the doctor dismisses it, and sometimes there isn't anything wrong.
Yeah.
But you say, doctor, I know my baby, and I feel there's something going on.
I worry too about kidney infections in babies. How do you know if your baby has a kidney infection? Because you can't really.
That's why they check the urine.
Right.
For what we call fever of unknown origin.
Okay.
Baby has a high fever, but mommy looks, besides the fever, baby, look, there's something going on. So that's one of the top things they check.
Okay, so make sure they check for that.
Yeah.
Do you have any advice for babies with eczema?
Yeah. See, the skin is what you put into the skin and onto the skin. So you feed it from underneath.
Okay.
And that's where the omega-3s from seafood comes in, a DHA, EPA, vitamin D, good protein, real foods.
Right.
You feed it underneath.
Right.
And then what you put on it, we would put a lanolin cream on.
Lanolin?
The same
like
cream.
The nipple cream?
Yeah, nipple cream. Called Lansano. Same thing mothers use on their nipples.
Yes.
I remember using olive oil sometimes, MCT oil, sometimes just oiling the skin.
Right.
Because when it dries out, it often gets infected.
Okay.
You want to give them extra fluids.
Right.
And all that. Vitamin D.
Okay.
Very good for the skin.
Okay.
So get a vitamin D level. You do a blood test.
Oh, on the baby.
Just a little finger stick blood test.
Yeah.
Yeah.
And check. Okay, so feed it from the inside out.
Yeah.
This is my last question. Is baby food, when you're feeding a baby and they're starting to eat, if my husband and I are eating salmon for dinner, can I put it in the food processor and feed the baby salmon?
Yes.
Okay.
Yeah. You're feeding the baby for two reasons. You're growing, for the growth. You want growth food. But also you want, it's called shaping young tastes. So what we do, we say, in the first 2 years, you want to feed your baby the food you want them to crave for the rest of their life. The tongue is very richly supplied with taste perceptors. And so you put a food on a baby's tongue, and that sends waves that go to the taste center of the brain that says like.
Right.
So you say you take a little piece of salmon at 7 months and put on baby's tongue, and avocado, mashed up vegetables, and sweet potatoes. Real food, just real food that you make. Same thing you eat, but you mash it up and everything.
Right.
And put a little olive oil on it, a little bit at a time. And the brain says, whoa, that's good for me. Like, and it sends text messages back to the tongue. Keep eating that because it's good for me. Yeah. And the gut.
Right.
See, the gut is called the second brain.
Yes.
For a reason.
Yes.
When you put real food into the top end, the gut will feel good.
Right.
See, so just real foods. Fewer cans you can open, the better.
Yes.
So just real food.
Yes.
Mash it up.
I love that story of Ashani always tells me about Devin when he was asking for SpaghettiOs.
Yeah.
And finally she said, okay, fine. And she took the can out and opened it and poured it in for him. And he said, that's dog food. Because he knew it was not good for him.
That's right.
And kids know. And she fed them so well. Same with my mom. And now I crave healthy foods.
Good. See that, and your mother was right.
Yeah.
And what was interesting is we found healthy to feed a child. They're going to go to parties.
Yes.
They're going to get junk.
Yes.
But I remember a couple of our kids, they would go to a party with junk.
Yes.
And they come home and say, Mommy.
My tummy.
I have yucky tummy, they called it.
Yeah.
I have yucky tummy.
Right.
Because they had been programmed. That wasn't real food.
It's not good. Yeah. And then their body knows. Whereas if they were eating that from the get-go,
the body knows.
They wouldn't even. What is the one thing that you see today that moms or anybody's doing that you think is just the biggest waste of time and doesn't need to be done?
Screen time.
Yes.
Okay. I realize that screens are here. They always will. Two things I'm concerned about. The eyes of a growing child. They're growing to real sunshine. These screens are not real light.
Right.
So the eyes are being accustomed to less real light. I'm afraid the shape of the eyeball will be affected.
Right.
Now, so that's my first concern.
Yes.
Secondly, they sit too much.
Yes.
All right.
Sitting disease.
Say sitting disease. We're made to move, for
Right.
why we talked about.
Right.
So what I see moms doing the right way, and let's face it, they need screen time sometimes, so you can get some stuff done.
Right, right.
Okay. For the older children, I say, don't ever look more than 20 minutes at a screen.
Yes.
Always rest your eyes.
Right.
Put the screen near a window that you can go from the screen to the real light, from the screen to the
Right.
real light. But with a young child, you put them down on a screen in front of them, but you can have a screen that shows them how to make a puzzle.
Right.
So the screen is showing you how to build something.
To do something applicable to
so
real
you
life.
the child is looking at the screen, and then there's the Lego or the puzzle. They're going like this to build something with their fingers, and their brain is like that, and they
Right.
go back to the screen, and they go like that.
Right.
So that's the way to use screens in, say, 3 or 4-year-old.
Right.
know,
So then they're
give 'em-
incentivized to do
Yeah,
something
something that's aside to the
tangible.
screen. Yeah. So the screen's just instruction.
Right.
Here's how to put the puzzle together.
Right.
Or here's how to build the Lego thing. Now, that's okay.
That makes sense.
Yeah, that's okay.
Yeah, and that's better than just them sitting there
Yeah,
looking and
exactly.
not really using
Yeah.
their mind or their skills.
Yeah.
Had to just say, read one of my books.
Well, I think it's the age.
Of what stage of life you're in.
If you're during pregnancy, it'd be the Healthy Pregnancy book.
This one, right?
That one. Once baby comes, first 2 years,
I'll
the
link
baby
all
book.
these too. Okay.
The baby book. If you have a mom and dad, older, Primetime Health is for seniors.
Okay.
The Healthy Brain book. We have our 40 to 50-year-olds read it to prevent dementia,
Dementia,
from
okay.
coming up. And then right now, if I have so many people just say, okay, I'm ready to get healthy, I just need a plan.
Right.
That's our
This
newest
is it.
book. It's a
And this
health
has
plan.
those 5:
Yeah.
eat smart, share smart, sleep smart, move smart, think smart.
Yeah.
Okay.
Okay.
Okay, this is the one for when the baby's 2.
Yeah.
Okay.
When the baby's born. Just when the baby's
And
born.
mommies and daddies should read these,
Yeah,
right?
that's right.
Okay.
Yeah.
Okay, perfect.
Good.
And I will link all these if anybody wants to buy his books. Are they on Amazon or your website?
They're on Amazon.
Amazon or his website. And his website also has so many questions and answers.
Yeah.
If
It's
there's
called
something we didn't cover.
Ask
AskDrSears.com.
AskDrSears.com.
Okay. I actually have a cousin who's a pediatrician. I told her about you.
Uh-huh.
And she told me sometimes she has parents come in and ask questions and she doesn't know the answer. She goes to your website.
Oh, good.
She told me.
Oh,
She's a
good.
Stanford pediatrician.
Oh, good.
Super educated, and she even goes to your website.
Oh,
so
good.
There's so much good information on there, more than
great.
what we talked about, I'm sure.
Super.
So, yeah.
Well, thank you,
so
Brianna.
much.